Welcome back to Longevity and Muscle Building. I'm Kris, your soft tissue and longevity expert, specializing in Ayurveda and muscular therapy. And today I wanted to talk to you a bit about injuries, why they occur, how to prevent them, and better yet, how to recover from them, whether that is a sprain or strain, or maybe you're just recovering from a surgical procedure. That too is an injury. I have a lot of experience with injuries. I grew up a competitive athlete as a gymnast primarily and tennis player, and later as a martial artist and Latin ballroom dancer. And I've had my fair share of injuries. In fact, it was my hip injury as a martial artist that turned my career trajectory from pursuing medical school in Boston, Massachusetts to getting into the holistic therapies and more Eastern ways of thinking and approaching not only recovery, but life itself. And you can read about that story on some of my other videos on YouTube. But what I want to talk today about with regard to injuries and muscle building is the range of our body's ability to adapt and shapeshift to provide whatever stability or mobility we need. In fact, I'd even dare to say it ventures more on the stability spectrum, and our active choices and activity in daily life provide the mobility. Both of them, of course, as always, being regulated by a healthy, balanced digestion and elimination. I talked about that in the basics video series. So take a look at that if you haven't yet seen it. Um, you know, Working as a muscular therapist is something that really allows me to geek out on my love of anatomy and really feel while I'm giving a massage what is happening with my client's soft tissue and where they're lacking, either in the stability of a joint or in the mobility of their body. And that is reliant on specific anatomy like osseous restraints such as bone spurs or even just a lack of bone density or maybe a fracture that did not heal well or completely. Or it can also be more on this passive spectrum of our ligaments, and in my case, the labrum in my hip, which tore. That labrum provided the stability for the femur bone to stay secure in my hip socket. And again, through my PT and rehab and athletic lifestyle, my active therapies involve my muscles, my tendons, and of course, retraining my brain and nervous system to rewire that signal that had been downloaded of chronic pain, which is, I think, also a large component of injury recovery that we forget therapeutically. We tend to, particularly in the fitness world, get really honed in and focused on the biomechanical aspects of tissue recovery and building tissue, which obviously has its place, yet what's missing is some of the more subtle aspects and the framework and kind of mental toughness and training that holistic systems like Ayurveda, yoga, martial arts, and all of these other kind of contemplative holistic practices offer. And when I have someone on my massage table or come into my office with chronic pain, oftentimes I will ask them about their feet. Why their feet? Their feet, your ankles, and all those tiny bones in the body that allow for the mobility of your ankle and foot as you step and run and jump and all these things will really determine your mobility and functionality throughout the rest of the body. It's what grounds us to reality in the world we're in right now. And as such, that divine intelligence and design of our body allows for that mobility in the ankle and foot joints, all those tiny little bones that make up our foot and those small bones of our ankle joints will allow for the foot to move in so many different directions and walk on uneven ground and not lose stability, yet keep our mobility. And as you work up the body in mapping, you'll see that it intelligently alternates in its design to provide both stability and mobility alternately as you move up the body, starting at that grounding point with the foot and ankle, and then moving up to the knee joint, which, yes, is mobile, but there are limitations in the movement that the knee can make, right? Flexion and extension, very little rotation, but it's about flexion and extension with the knee. So that provides stability. And then the hip joint is much more mobile, moving in all directions. SI joint does have, again, a little bit of mobility, but largely it's a stable joint because of those ligaments that are holding that in place. And again and again and again, working up the body, you see this intelligent design of allowing you both stability and mobility. And when we are lacking, usually in functional strength or in fascial health, it results in injuries. And it's typically an overstretch or a traumatic tear in the muscle tissue. It's not the microscopic tears in healthy, sustainable muscle building, but it's a traumatic, blunt force trauma or high velocity trauma or stretch that causes these larger injuries to the tissue. And then, we have, as I've said before, the common injuries of tendonitis and strains and sprains are commonly a result of our lifestyles and our ability to balance those three mind-body principles of vata, pitta, and kapha, keeping tissues in that warm and moist range that Ayurveda likes to thrive in, or life thrives in, and be able to keep that lubrication and that anabolic quality of kapha dosha in keeping these tissues lubricated, nourished, and flushed of metabolic waste. And the reason why muscles can do what they do is because of their capacity for being excited, being able to respond to chemical, electrical, or mechanical stimuli for activation. Quite literally, each tissue is customized based on a biomechanical force. Your meniscus tissue, for instance, in your knee, and the vertebral discs in your spine, those are designed to handle compressive forces. That's why they have more water content in them. With regard to your tendons, we have extensibility, the body's ability to stretch without being damaged. This, of course, needs to be done again slowly and sustainably. Those high velocity or high intensity sporadic workouts that we see with the structure of the house, that stick house, which you know, movement is good, strength training is good, but we have to do it in a really intelligent way. And muscles have a limit to their extensibility until you've trained it to go that much further. And then on the opposite side of that is the muscle's elasticity and its ability to recoil and release whatever action was performed and return back to its original length. Is another indicator of the quality of muscle tissue that we have, and its ability to contract quickly in emergency situations, taking in a lot of information, tapping into those fast twitch fibers to respond and utilize energy and glucose quickly and efficiently. And these are the qualities of muscle that we're talking about when we talk about longevity and thrive. That when we're able to incorporate the circadian living practices of Ayurveda and bring Vata, Pitta, and Kapha into concert together for strong, healthy digestion and metabolic exchange and communication, we have really strong, healthy tissue. And the overscheduling and the intense workouts and the inadequate rest and prioritization of it leads often to these injuries. And from a Vedic perspective, when we have an abundance of air and space elements in our lifestyles, in our habits, in our diets, then we often will see that in the body with a catabolic effect, muscle wasting, atrophy. You'll see it in the joint space as popping and clicking, maybe even some scoliosis or malalignment in the spine. This is where often pain experienced is triggered by movement itself, and there is often a denigration of bone mass as well and bone density when left out of check, if you will, out of balance, right? When we have too much movement in our lives or we have too much intensity in our lives, that's the pitta dosha and the fire element primarily, a little bit of water as well. But when we're having this intensity in our workouts, then that heat and excess heat dries out the tissues. And so we are too warm and lost the moisture. And this is what we see with um, the, the trajectory of autoimmune conditions toward thyroiditis, Hashimoto's especially. I see that a lot with that intensity kind of approach to workouts, to longevity and just life itself. And often you'll experience that heat in the body somatically through burning sensations and even maybe feeling tears and heat. There's that catabolic effect, muscle tissue breakdown, as well as inflammation, where the skin or the joints are literally hot to the touch. And the pain pattern when there's excess fire element and this intensity tends to be persistent and not related to movement at all, independent of movement. But the pain is ever present, if you will. It's frequent and it's persistent. Now, let's move to the other end of the spectrum and range where we have too much sedentary habits and we are indulging too much in the processed foods and in our emotions. We are then experiencing that heaviness in the body. And there's a healthy way to go about it, which I'll talk about shortly. But the pathological view of trying to go about rest and restoration can look like this, where we have not enough heat and intensity to circulate and metabolize all that we've taken in. And as such, there's a stagnation and a real challenge to that mobility nature of vata to move about nutrients and move out the waste. And so we see this in obesity, fibrocystic changes in tissue. Often I will palpate cysts or lipomas while I'm massaging people in those deeper layers of tissues. Um, Often there's also tongue-tied, there's also often hypermobility in the joints. There's too much moisture, too much lubrication, and not enough functional strength. And so again, approaching our wellness and that approach to balance is a bit like Goldilocks. We don't want too much moisture, we don't want too much heat, but we do want it warm and moist. And when we are inadequate in modifying our habits and lifestyles, this is what it looks like. Cold and clammy joints, often edema and swelling, and a lot of water retention. So my role as a body worker and hands-on is often to start literally clearing the channels of digestion, circulation, and elimination so that in the physical body, we can restore balance and decrease spasms and kind of the other symptoms of stiffness and getting you a greater range of motion and training you in being more aware of the sensations and cues in your body and being aware of your experiences of it and of the world around you. Training in that awareness and proprioception, as we call it. Certain techniques that I may do with my hands or use a massage gun for, or even teach you how to do, as I do in Alchemy Club. We do self-myofascial release with massage balls and foam rollers. So we are, again, creating that biomechanic trigger to the tissue to start the regenerative response. I used the meniscus and vertebral discs as an example earlier. Another example would be your thoracolumbar fascia, those broad, flat aponeurosis, those sheets of connective tissue that you see on anatomy diagrams, all that white patches between large muscle units and groups. That responds to shearing forces. So rather than trying to compress down into that tissue, like in a deep tissue massage, I'm going to want to push and plow the tissue in a certain direction to elicit that regenerative response. And so you are a shapeshifter. And while you are maybe acutely injured in those early stages of injury, those first 3 days we would consider acute in an injury, you might have heard of the RICE acronym, right? The rest, ice, compress, and elevate. And it's a bit outdated. There have been modifications since that acronym to how to respond to injuries. And I came across this great modification here, peace and love. The peace part is during that acute and subacute phases of an injury, which would be up to 2 weeks after the initial injury. And here we're generally not going to be moving that much. We're going to stay in peace mode. We're protecting the area from any sudden movements or jolting forces. We're elevating that area to help return blood flow back to the heart and lungs and reduce the edema and swelling that we see so much because of the inactivity. We're going to avoid and use common sense, avoid activities that would be reproducing pain or risky in nature. Compressing the area with ACE wraps or athletic tape as a way to help provide some additional stability to an area while it's recovering. And to educate yourself around what your injury is and what you can do to modify workouts moving forward, or find tools like braces or kinesio tape or other kinds of tools and approaches to supporting some of these common soft tissue injury sites: patellar tendonitis, bicep tendonitis. I'm an active competitive tennis player, and so I tape a lot of tennis elbows on the court, golfer's elbow, and Achilles tendonitis. These are all things that are largely influenced by our rhythms, by our diet, by our capacity to really digest everything that we take in. And so after you have reached that initial 2 week subacute, acute stage of an injury, then we'd like to turn our attention to love, right? We want to get circulation moving. We want to start loading that tissue. And this can be challenging, right? Often there is early success and then a plateau or a regression. And this is where we have to also build in some of the mental skills and drills that you'll see in your accompanying workbook to this series on how to train the brain and repattern any lingering messages of unsafety and of pain itself. And that's to love it and load it. Once those acute stages are of the injury have passed, it's time to start loading it and weight bearing based on your doctor's recommendations or your physiotherapist's recommendations and your own common sense and intuition. knowing that your body will send you the signals and its requests. And if you're quiet enough and still enough, you'll hear them. And starting to massage the tissue yourself at home gently every morning before you get in the shower. I like to use a particular Ayurvedic formula called Mahanarayan oil from Banyan Botanicals. This formula is particularly known for its anti-inflammatory and analgesic properties of the plants, and it's formulated in a sesame seed oil base, which is slightly warming and deeply nourishing to the tissues. And so softly massaging some warm Mahanarayan oil or maybe some castor oil around the injured area. Now, you're going to be avoiding any suture sites or any open wounds or infections. We're talking about healed, closed wounds that have been okayed by a doctor to start circulatory action with. So getting that massage in is wonderful, as well as some warm compresses. We want to feel the throb in the therapeutic path. Throb means healing. Throb means things are moving, exchanging nutrients, waste, information. And you can really show up for yourself and start downloading messages of safety and love and optimism. And that really will take you in the long run to pain-free aging, because a lot of it is mental, especially when the biomechanical and tissue itself has been healed. So warm compresses, oil massage with Mahanarayan or castor oil, retraining the brain and investigating without fear. Investigating without fear, starting to tap into what I call somatic tracking with a three-part process. Step one, you're going to tune into the sensations that you're experiencing and pay attention to them without any judgment. You're just simply going to observe them and acknowledge them. Step two, send messages of safety to this area, right? This is a working meditation. It's a visualization. You are literally assuring this area of sensation that all is well. And when you do that, see if you can recall any previous evidence of safety as examples, that it is safe to move, it is safe to circulate, it is safe to exchange and engage. And then step three, finish with a positive affect. Think about something funny. Listen to a funny podcast or your favorite comedian. I love stand-up comedy for this reason. It really does. You know, you've heard of laughing yoga as a modality maybe, but finding laughter, something funny, a funny image, a meme, a movie, a joke, let that be the final slice of bread in your love sandwich in building that regenerative response. There are other ways that I get into more detail in Alchemy Club as to building the healthy tissue. In Ayurveda, we generally would focus on kapha building foods. These are going to be your root vegetables. Sweet potatoes are like number one on natural muscle building, tissue fortifying foods. So all your root vegetables for that matter, your squashes, your sweet potatoes, your beets. And this is one of the reasons why in fall and winter season, nature provides these kinds of medicine for us in preparation for winter, where the elements of wind and air and dryness usually become more dominant in most parts of the world. And as such, we have this catabolic and wasting away. So nature says, manja, eat with these natural building foods like root vegetables. Quality fats and oils like ghee, coconut oil, almond oil, and if you do eat animal protein, animal fats, providing that collagen into the body, and lubrication as well, that kapha producing quality. Now, the Vedic sciences are primarily vegetarian and plant-based, but there is classically in the Vedic texts some sourcing of using animal protein. Typically, when that's done, it's prepared in a crock pot soup stew like fashion. Yeah. And then just the liquid portion of that substance is taken in. Now, I'm not a personal trainer. I'm not a fitness expert, right? But I can say that, generally there is an excess intake of protein, animal protein, in the Westerns, particularly American diet. Um, and so other ways of building, if you are plant-based, other than, or maybe you do eat animal protein and you want to pull back on that a little bit, for that balance, then lentils, split mung beans are wonderful. Green split mung beans specifically are wonderfully building to tissues. So creating nicely spiced and uh, cooked with ghee, well-cooked foods are going to allow for that natural muscle building. Also, bananas and nut butters and foods that share the quality of earth element, that density, that heaviness, are going to be the foods you'll want to favor when you're recovering from an injury and wanting to build naturally those healthy tissues. You can look to more resources in your workbook and watch the next video where we talk about routines to actually perform and rhythms to tap into so that you can perform at your best.